Yeah, man, good evening, good evening, good evening. Welcome to another episode of Unscripted Anything Goes. Delvin Sadler is here. Delvin Sadler is here. Yeah, man, people. Greetings, greetings, greetings. Nice weekend just passed. Yeah, man, nice weekend just passed. Father's Day just passed yesterday. Greetings. The World Cup has started. Yeah, man. I watched some games. I watched one game today. England versus I wouldn't play again. Tunisia. Yeah, man. 2-1 victory for England. Yeah, man. And it was entertaining game. Unscripted, anything goes. So are you people in the World Cup fever, the vibes of the World Cup? Straight up. Yeah, man. Delvin into soccer for a very long time. Yeah, man. Straight up. So if you are supporting the World Cup, yeah, man, to which you support? Which team do you support? Yeah, man. Yeah, man. Straight up. Unscripted, anything goes. My pick is the French. France. Le Français. Yeah, I'm picking France to win the World Cup. Yeah, man. I'm picking France to win the World Cup. Yeah, les Français. Parlez-vous français? I'm picking France to win the World Cup. Yeah, man. Yeah, man. Big up yourself. Jacinta. I love you. You're the queen. I love you, girl. Unscripted. Anything goes. Yeah, man. Timothy Borland. Big up yourself, my brother. Thanks for joining. Unscripting. Anything goes. Yes, Rasta. Greetings, people. Yeah, man, to all the fathers out there. I want to say, yeah, man, you are constant. You are constant because you are father. And Delvin say, yeah, man, that's a good thing. You didn't need yesterday to be recognized as a great father. Yeah. But even so, I want to say, Happy Father's Day. Yeah, man. Happy Father's Day to you, true fathers. Yeah, man. Straight up. Unscripted. Anything goes. Big up yourself, Errol Archer. Yeah, my brother, Errol Archer. Thanks for joining. Unscripted. Anything goes. Yeah, man, people. With my heart, I want to say thank you. Thank you for the well-wishing yesterday that you sent to Delvin saying, Happy Father's Day. I'm thankful for that. Truly grateful. Unscripted. Anything goes. Big up yourself, people. Yeah, Audrey. I love you, girl. Delvin. Love you. Straight up. With my heart. I want to tell you, yeah, man, I love you. Yeah, man. Yeah, man, I'm coming there Friday. Yeah, man, I'm coming there Friday. Friday, you'll see Delvin for sure. I will be there Friday. Yeah, man, I'm coming Friday. Archie. Yeah, man, big up yourself, girl. Unscripted, anything goes. And we've got a nice subject matter for you tonight. Yeah, man, tonight. Yeah, man. Sharon. Yeah, man. Sharon. Thanks for joining. I love you, girl. I love you. Unscripted, anything goes. A nice subject matter for you tonight. We're going to talk about, the cancer continue. The printer is working. Cervical cancer. Tonight. Yeah. Cervical cancer. Last time we spoke about breast cancer. And tonight, cervical cancer. That's what we're talking about tonight. Yeah, man, Audrey. Big up yourself, girl. I'm coming Friday. I'll be there Friday for sure. For sure. I'm gonna stop by on Friday. Big up yourself, girl. I love you. Yeah, man, straight up. Unscripted. Anything goes. So, people, did you do something special, especially you ladies, for your, yeah, father, or for your kids' father, or your husband? Did you do something special for them yesterday? Because that was your time to shine, to let them know that they are actually appreciated. Yeah, man, Jacinta. Yeah, man, he cooked me a nice meal yesterday. Yeah, got a nice little shirt and stuff, you know. It was a nice spending of evening with family. Yeah, man, straight up. So because I know you ladies from this room, yeah, you did something special for, yeah, man, your father or your kid's father. I decided to forego the show last night. Yeah, to have you spend that special time with fathers. Yeah, man, big up yourself. Yeah, man, Camille. Yeah, man, Camille. Yeah, man, Camille Essence. Big up yourself, girl. Thanks for joining. Unscripted, anything goes. Camille Essence. Yeah, man, straight up, thanks. I appreciate that very much. Earl Ears. Big up yourself, Early Ears. Big up yourself. Thanks for joining. Unscripted, anything goes. Yeah, man. So I hope you guys did something special for that special father yesterday, whether it be your father or your kid's father. Hope you did something special. Yeah, man. Truly. If somebody's a father and not a deadbeat, they deserve special treatment. Because you know Delvin don't support deadbeat. Not one bit. Yeah, man. Bastard. Yeah, man. I don't support them. Not one bit. So for the true fathers out there, I hope you did something to make them proud. Straight up, Delvin said that. Yeah, man, my wife did something nice, you know, and I appreciate that. Yeah, man. Unscripted, anything goes. So we're going to talk tonight about cervical cancer. But first, let's go through protocol. The protocols are these: no rules. And also, you have the right to come on camera at any time and speak. You can also change the subject matter at any times. Straight up. We don't talk bad about people, we talk about ourselves. Unscripted, anything goes. So, cervical cancer. What you need to know about cervical cancer. Yeah, man, it's a dangerous cancer. It's a dangerous cancer that affects women. So, cervical cancer is a form in cervical cancer forms in the interior lining of the cervix. So, your cervix that is along the vaginal walls down. It's yeah, it just, there's a cancer that forms within that lineage. The junction of the vagina and the uterus. The development of this cancer is typically low and occurs over a period of years. And the progression of the cervical cancer begins with the development of precancerous changes in normal cells. Most of these changes, even if left untreated, will not progress to cancer. However, in 2016, the American Society of Cancer estimated that 12,000, let's round it up, 13,000 women, will diagnose with invasive cervical cancer, and 4,300 will die of the disease in the United States. So approximately 4,000, let's round it down, people die from cervical cancer in the United States. Yeah. In any particular year. Yeah, so in 2016 they estimated that 4,000 people will die from it and 13,000 will actually be diagnosed with cervical cancer. Yeah, man, big up yourself, my brother. Yeah, man, big up yourself. I love you, my brother. Thank you. Yeah, man, big up your daddy. Yeah, man, straight up. Yeah, man. So this is a serious thing. Cervical cancer. It's a very serious thing. And this is coming from the cancerquest.org. Straight up. Cervical cancer is most often diagnosed in middle-aged women, with half of those diagnosed between the age 35 to 55. So half of the people who has cervical cancer is between 35 to 55. Cervical cancer is very rarely seen in women less than 20 years old. Yeah, man. So if you're under 20, it's very rare that you'll get cervical cancer. But approximately 20% of cases occur in women over 65. So 20% of the numbers of people that have cervical cancer are actually over 65, demonstrating the necessity of continuous screening process. So you must be screened for it. So go through your physical with your doctor, and in that physical they'll check for cancers. And if you have cervical cancer, it will show up on your physical. Straight up. 5 years, the 5 years cervix survival, let's put it again, 5 years survival rate of invasive cervical cancer. So once you're diagnosed with invasive cervical cancer, 5 years you have to live. Yeah, yeah. Currently, 71% and improving in screening and development of prophylactic vaccine have decreased the incidence of late stage cervical cancer. So if you have cervical cancer and it's caught early, 71% improvement in the chance that you would actually live by the vaccine, which will decrease your incident of late stage of cervical cancer. Yeah, straight up. Big up yourself. Yeah, man. Yeah, man. Good evening. Yeah. So the cervix is part of the female reproductive tract that makes up the lower part of the urethra. All right. Also known as the womb. Straight up. The upper endocervix connects to the uterus, and the lower heterocervical region of the vagina. This connection allows for the passage of fetus to be delivered, right? Straight up. Big up yourself, R10s. Thanks for joining. Unscripted, anything goes. We're talking about cervical cancer tonight. Yeah, man, straight up. So the vagina, right? The female organ, the passageway for menstrual blood and fetus during childbirth. So in the vagina, the fetus will pass through there, and also the child will pass through there, right? So, and that's where you have your menstrual passage, okay? And the cervix region now, it's connected to the uterus, to the vagina. The muscle of the cervix support the weight of the fetus during pregnancy. The uterus, which is the womb, yeah, location where fertilized egg developed into the fetus, and it is nourished until birth. Note that the walls of the uterus are thick and the linings with muscles. Straight up. So the fallopian tube, which you all ladies know about, the location of the fertilization of the eggs and the sperm cells. The ovary, all right, produces store eggs and produces female sex hormones, estrogen and progesterones. Straight up. There's two types of cervical cancers. They are the cell carcinoma and the adenocarcinoma. All right, so you can look up those. It's the adenocarcinoma, okay, which are digested based on the appearance of the microscope. All right, so you need a microscope to actually see these kind of cancers. Straight up. All right, so you look those up more, but I'm just telling you what they are. There's two types. Yeah. The risk factors. So this is what you need to know. Risk factors when it comes to cervical cancer. There are several risk factors for development of cervical cancer, both genetics and environmental. So you can actually get it from your genetics. And these include, all right, the biggest one here is the human papilloma virus infection. Yeah, man. That's the HPV virus. And we did a show on that already. So it's the human papilloma virus, the HPV virus. That is a big concern when it comes to cervical virus. That is a big killer to cervical cancer. Yeah, your family history can also play a part in you getting cervical cancer. It could come through the gene process. Your age, your age have a lot to do with it. So if you're young and under 20, you won't catch it. If you're over 20 and up to 65 or over 65, then your risk in getting cervical cancer actually increases. Yeah, your sexual and reproductive history. So if you're one of those person that is what do you call it now, promiscuous, meaning that you have a lot of partners. Yeah, if you have a lot of partners that you're going around having unprotected sex with and a lot of oral sex with, then your chances of going up, your chances increases if you have to get cervical cancer. Yeah. Yeah, man. If you're a smoker, yeah, you increase your risk as well. Yeah. If you have HIV infection, you also actually increase your risk of getting cervical cancer. Straight up. If you're also, I didn't know this one, but if you're also a long-term user of oral contraceptive, if you're a long-term user of oral contraceptive, yeah, your chance is also increases to get what do you call it now, cervical cancers. Yep. So let's look at it carefully here. All right, let's start with the HPV. That's the human papilloma virus. So the HPV infection is associated with virtually all cases of cervical cancer. So most of the people that are diagnosed with cervical cancer, most of them gets it as a result of the HPV virus. Yeah. So HPV is among the most common sexual transmitted disease, and most women clear the infection within 2 years without complication. Long-term infection with high strain of HPV can lead to the development of cervical cancer. All right. So if you have HPV virus, the human papilloma virus, the earlier you treat it, it's the better it is for you. But if you have that long term, yeah, chances are you will develop cervical cancer. Straight up. So what this is trying to tell you is that, you got to be monogamous, or be as monogamous as much as you can, and don't swallow bad semen. Yeah, don't swallow bad semen. Or fecal matter. Shit. Yeah, because you can now expose yourself to the HPV virus, and that is a very difficult thing to get rid of. Yeah. So yeah, man. So the earlier you treat HPV virus, if you do have that, it's the actual it lessens your chances of getting cervical cancer. And if you let the HPV stays in your system for a length of time, chances are you'll get cervical cancer. Yeah. Yeah. So if you're gonna swallow semen, make sure you swallow semen of your partner. Yeah, don't swallow semen of a lot of people. Don't go around swallowing every man's semen. Swallow the semen only of your partner. You know, swallow semen is healthy, but don't be going around swallowing semen of every person. Some of them just dirty people. Yeah. So swallow semen only of your partner if you're gonna do that. Straight up. Yeah, man. There is no cure or treatment for HPV infections. Right? We talked about that already. Yeah, no cure or treatment for HPV infection. Straight up. Even without treatment, most infections are cleared by the immune system. Yep, within 2 years. So within 2 years, the system will actually clean itself of it. But if you constantly know exposes yourself to the HPV virus, yeah, it will just keep stay in your system because you keep exposing yourself to it, and then as a result you will develop cervical cancer. But over the years you have different partners. Okay. Yeah. Listen, you can have different partners, you know. You can have different partners, but you must have protected sex. You can't just have partners where you're now having unprotected sex with every single partners. And you can't just go around swallowing everybody that you're exposed to semen. Yeah, ladies, don't go around swallowing every man's semen. If you're going to swallow any semen, make sure you swallow it to somebody that you're committed to and they are committed to you. You guys are monogamous. Yeah, if you're not monogamous and you're promiscuous, that means you guys are having sex with other people openly, then just swallow just his sweet semen. Don't be swallowing everybody's semen. Yeah, if you're gonna swallow semen. If you like to swallow semen. Because a lot of women out there like to swallow semen. Yeah, yeah. So if you like to swallow semen, and I know quite a few women who like to swallow semen. So if you're gonna swallow semen, just swallow semen of one person only. And make sure that they're monogamous to you. That they're not going around having unprotected sex with more than one person. So that you limit that risk of the HPV virus. Alright? Yeah. Yeah, man, straight up. Straight up. Yeah, man. So if the infection persists, like it keeps, you keep taking it on even after the body is trying to replenish it, to replenish itself of the virus. If the infection persists, there is an increased chance that the viral DNA integration and progression to cancer. Just as I said earlier, if you constantly exposing yourself to the HPV virus, you will lead to now getting cancer, especially you women getting the cervical cancer. So 8 women can be tested to learn if they are infected with HPV virus. Even though there is no current cure for the HPV infection, the knowledge can help to make responsible choices regarding their sexual practices. So there you go. So if you get tested, get tested all the time for all cancers and all disease and virus and all these things. Don't be afraid to get tested. That is the main thing. Don't be afraid to get tested. So if you get tested for it, the earlier you're detected, then you can actually now adjust your lifestyle to actually now reflect the result So let's say you go and you get tested for HPV virus, and it says that you have it. You have to wait for the virus to work itself out of your system. So you know now you can't just go around swallowing sperm. Yeah, you have to allow the virus to work itself out of you, and then you have your spouse now, yeah, get proper treatment to clean up themselves, yeah, or to allow the virus to work itself out of them. You know what I mean? And don't swallow your sperm. Do a pap smear regularly. Yeah, you have to do a pap smear regular. You have to do a pap smear regularly, good ladies. You must. Yeah, at least every 2 years you do your pap smear. Yeah, man. Big up yourself, Dana Marie. Thanks for joining. Unscripted, anything goes. Yeah, man. Your family history can also, yeah, leads to cervical cancer. Women with family history of cervical cancer, especially an affected mother or sister, have twofold risk of developing cervical cancer. So if you know that your mother died from it, like I told you the story the last time of the lady, yeah, the young lady that died from cervical cancer because her mom died from it, and the government keep telling her, the Ministry of Health kept telling her to come and get tested, and she refused to do it, and then she got sick and think it's Hobia people working on her, but it's the cervical cancer. So her mom had it, and she got it as well. So as a result of that, she should have gotten tested. So that she can get proper treatment to deal with it. But instead, because she believed in Obi and all of these things, she eventually died from it because she never took the advice of the doctor and got checked. Yeah, man, big up yourself, Arville, my brother. Thanks for joining. Unscripted, anything goes. So, as it says here, yeah, if your mother or your sister or somebody in your family history had cervical cancer, yeah, chances are, you should actually be careful. It says, especially affected mother or sister, you have a twofold risk of developing cervical cancer, suggesting an inherited susceptibility. Yeah, susceptibility. Yeah. However, there does not have to appear to be a correlation between the family history or the cancer history. You understand? So your chances or your risk factor is a lot higher, but it's not necessary that you will get it. So you just have to know your family history. And if your family history now has that in it, get tested. Get tested for it. Yeah. And then you don't want to open yourself to the HPV virus, because once you get the HPV virus, chances are that will now lead you to getting, full-blown cervical cancer. So you got to know your family history and know if there's cancers in your family histories. And if there's cervical cancer, you need to actually, as women, take even more precaution. Straight up. So know your family history. Know your family history. So the next thing is Delcy Russell. Big up yourself, girl. Thanks for joining. Unscripted, anything goes. We're talking about cervical cancer. Age is a factor as well. Very few women under 20 are diagnosed with cervical cancer. Very few. And more than half of those diagnosed between the age, 35 to 55. So if you are between age 35 or 55, make sure you get tested. Get tested for it. Especially, all of us, we've had several partners during our lifetime, right? We've had several partners and we've had unprotected sex with several people during our lifetime. Some of us have been divorced, and in our previous marriage, we had unprotected sex for years with that person. Yeah, straight up. And who knows, what that person's been doing. or what you have done. So you need to get tested. Get tested. Straight up. So your age factor, yeah, the risk factor of getting HPV virus, the older you get, is the more risk that you have to develop. So if you're between age 35 and 55, yeah, that is the concerned age. Within that range, get tested. Yeah, the risk decreases after 55. Yeah, after 55 years old, your risk of getting cervical cancer decreases. However, 20% of cases occur over 60 years old. So even though the risk has decreased of you getting cervical cancer over 65, you still have a chance of getting it. Yeah. Yeah, so if you're over 60 years old, yeah, 20% of those that are infected are over 60 years old. So you still have a risk, even though you're not in the high risk category of 35 to 55. Yeah. So get tested irregardless of age. Get tested for the cancer, cervical cancer. The pattern the pattern seen is due to two conflicting factors, according to this. Yep. Change in sexual behavior and tendency of genetic mutation to accumulate over time. So, all right, sexual and reproductive history. Let's look at that. Sexual and reproductive history. Yeah. Epidemiologically, studies shown that an increased risk of invasive cervical cancer attributed to sexual and reproductive behavior, increased number of sexual partners, and lower age at first sexual acts have both been associated with increased risk. So, as we just spoke about before, if you're one of those persons who have had a lot of sexual partners, if you're promiscuous, and when I mean promiscuous, that means you're having unprotected sex. If you're having protected sex, that means you're using a latex condom with lube or whatever when you have sex, then you have nothing to worry about. If you are now having sex with a lot of people unprotected, yeah, or you're as women now, you're having sex with a lot of people, but you're also swallowing semen of all these people, then your risk is high, yeah, to get cervical cancer. You've increased your risk in getting cervical cancer. Yeah, man, big up yourself, D-Man. Thanks for joining Unscripted, Anything Goes, talking about cervical cancer. So it's important that if you're having partners, sexual partners, that, you try to at least have one person, if you're having unprotected sex with, and have them, yeah, only have unprotected sex with you, if you can control that. However, if you're promiscuous and having more than one sexual partners, use a latex condom. Use a latex condom. Yeah, use a latex condom. And if you're swallowing the semen, yeah, swallow the semen of just that one person that you're committed to. But don't be going around swallowing semen from every person that you have sex with. Don't do that. Don't do that. Yeah. Don't do that. Don't do that. Yeah. So you've increased your risk. Yeah, if you have more than one sexual partner. Straight up. Yeah. Yeah, man. Yeah, man. Yeah, man. Good night, Geraldine. Thanks for joining. Unscripted. Anything goes. I love you, girl. Thank you. So women who have had multiple pregnancies and are younger at the time of their first full-term pregnancy also demonstrate an increased risk. So if you've had multiple pregnancy and you had, if you got pregnant young, and you've had several different pregnancies after that, your risk and chances increase in getting cervical cancer. The long-term use of oral contraceptive. Yeah, for all of you women that use a lot of birth controls, yeah, the long-term use of oral contraceptive have shown to increase the risk in some studies, according to this, but remain controversial. So in 2007, studies suggest that ongoing use of contraceptive raised the risk of cervical cancer. That's what this says here, not Delvin. Yeah, yeah. It says in 2007, studies suggest that ongoing use of oral contraceptive raised the risk of cervical cancer, but the risk diminishes when you use contraceptive, when the use of contraceptive is stopped. So if you stop using contraceptive, then your risk now diminishes. Yeah, it goes down. But if you're using contraceptive, like from, a lot of you start with contraceptive when you're 16 or 15. Yeah, if you are using contraceptive from that point to now in your 30s, 40s, 50s, straight, yeah, your risk increases. Straight up. But if you stop using it as of today, yeah, your risk will decrease. yeah, straight up. Yes, risk will decrease. I say stick to the condom, yeah, man. Stick to condoms and lubes. Condoms save life, and condoms are good things. They're a great substitute. Yeah, I wear them. They're good. Nothing is wrong with them. Yeah, but the birth controls and all of these things, yeah, man, you think you're doing something good by preventing pregnancies. However, you could be doing a longer lasting damage to yourself by using those contraceptives. Straight up. Yeah. So it also states that because HPV is sexually transmitted disease, behaviors that increase sexual contact are considered risk factors. So, yeah. So, yeah, we already spoke about the HPVs. So you have to watch your behavior so you don't increase the risk of HPVs, like having multiple partners and actually swallowing semen of all those partners. You got to be careful of that, or have them all ejaculating inside of you. Yeah. You have all of these men ejaculating inside of you, leaving different sperms in there all the time. No, just have one man ejaculate inside of you. Don't have all of these men ejaculating inside of you. Yeah, straight up. Yeah, man. Yeah, man. Yeah, man. Some of these men are carrying bad bacteria. Bad bacteria that is not good for you. Yeah, just have one man ejaculate inside of you. Don't have all of these men ejaculating inside of you. Straight up, if you're gonna do that. Yeah. Social economical status. The social economical status also has a lot to do with cervical cancer, according to this. It says low social economical status have proven to be significant risk factors for invasive cervical cancer due to its large impact on education and medical resources. Result of the analysis of several epidemiological studies indicates that Hispanic and African American women have a higher risk of invasive cervical cancer than Caucasian women. Yeah, straight up. Yeah, man. This is what it says here. So, because of the social economical factors, yeah, of Hispanic and black people, it says they have a higher risk of invasive cervical cancer than Caucasian women. Straight up. Decreased risk is associated with increased education. So, knowledge is important. Knowledge is important as to how you must conduct yourself. Yeah. To avoid getting cervical cancer. So it says decreased risk with increased education. Women without a college degree have an increased risk regardless of race. Therefore, it is possible that if access of screening, and medical education are equal, race would not prove to be a significant factor. So therefore, what it's saying here is that some people don't get screened because they don't even know that the screening exists. Some people don't get screened because they can't afford to go and get screening. Some people don't have a, insurance medical plan that covers the screening, so they don't get screening. The screening is not free for everybody. So because they're not educated to the point where they now can get a job that has the insurance coverage so that they can get the screening, they do without getting screening. And as a result of it, they're higher risk. And this has to do with the African American population and Hispanic population. The lower class of people that don't have the medical coverage to get proper screening. So the social economical factor is regards to lack of education with regards to leading to getting a better job that covers you with the insurance necessary to get screening. Straight up, unscripted, anything goes. Yeah, man. The increased risk factor with low social economical status is attributed to the lack of screening, failure to treat precancerous conditions, and lack of knowledge about prevention of HPV infections. So they're not getting screened. One, social economical people, the black, Hispanic people, they're not getting screened. They're not even aware of the risk factors associated with cervical cancer. They're not even aware of how they can get the HPV virus. Yeah? They're not even aware of the preventive factor in getting the HPV virus. So as a result of it now, because they're low educational, low on the totem pole where job is concerned, they're more of a risk factor. Yeah, man. I do a full body test in and out. Yeah, man, you're right about that, Geraldine. And that is what we're trying to stress here. Especially people here in Canada, where it is free. Yeah, where it is free. Yeah, Delvin is helping to pay for it. My taxpayer money is helping to pay it. Take advantage of it and go and get screened. Yeah, get your physical done. Yeah, so that you can actually reduce your risk to make sure that you're okay. Straight up. Yeah, man. Delvin is telling you, go and get it. It's free. Go and go get it. Go to your doctor and get a full physical done. Yeah, man. Go and get a full physical done. It's the right thing to do. It's the right thing to do. Why not? Why it's not the right thing to do? It is the right thing to do. Get a full physical done. Excuse me for a second. Let me plug this in properly. Okay. We're good now. Yeah. Yeah, man. Go and get your full physical done. The needles are not free. $70. I do a full body test, and no, the needles are not free. What needles? Which needles you're talking about? Which needles you're talking about? Tell me about the needles you're talking about. Which needles are you talking about? Like, for those people who are... What needles are you talking about? Yeah. Yeah, like something your insurance have to pay for when it comes towards prescription. So if you're one of those person that needs to get an injection needle, then you either pay for it or you actually go and through your insurance, they'll pay for it. Okay, let's hear what Geraldine has to say. All right, come on now. Big up yourself, Geraldine. Unscripted, anything goes. Big up yourself, Kizzy. Thanks for joining. Unscripted, anything goes. I love you. Yeah, man, straight up. Talking about cervical cancer tonight. Let's see what Geraldine has to say about the needles. Yeah, man, people. Big up yourself, girl. I love you. I love you. Unscripted, anything goes. Geraldine, how are you doing tonight?
I'm fine, Delvin.
You're doing fine. Yeah, man. So you get
Yes.
your...
Okay, the needle I'm talking about is if you go for the pap smear test and you want to do an insert of the camera inside of you,
Okay.
and you want to do the blood work to see what going on inside of you, you have to pay for the needle, and the needle is $35 for one, and the doctor says $70 for the two. So they take blood work, send it away, and test it
Okay.
to see if you have anything inside of you, like
Yeah.
cancer or
Yeah.
what you call it now, cysts and all those
Yeah,
things.
I know what you're talking
Those you
about.
have to
Yeah.
pay.
So it's a different company that does that. That the OIP don't covers
Yeah.
that, but the OIP actually pays the doctor to do that for you. But it's just a company, the lab that does
Yes.
the analysis that you have to pay separately for that test. And the $70 is worth it. I think the $70.
Yeah,
Go ahead.
because I do it every a couple days ago, you sent me back to do it again, to repeat it to find out about it, and then I went back.
Oh, yeah. But if you
So
have insurance,
if you want to do a fully body
Mhm.
test, if you want to do a fully body test, you have to go through to get that needle.
Yeah.
When you go for the pap smear test, the pap smear test really don't show much
Right.
until you go through the full body test, and they put a camera inside of you and insert it. That camera is hurt like a hell.
Yeah. Okay, you're virgin again. Yeah. Yeah. So then the analysis go to this lab that does that for you. But the thing about the thing about the $70, if you are working for a company that has the insurance to cover it, then you can actually get back that money from the insurance company. But for those people now,
I know. I have insurance, but I never send up for it as yet.
yeah, well, you have to send it
And
in.
then they want to send me for the breast thing. I don't know if I can go for it. I hear that one hurt like hell,
The mammogram.
but I'm going to try. Yeah.
Yeah, you have to do it. You have to do it. You have to do it, because earlier detection,
But
the earlier you detect things, it's the better it is that you can actually get
yeah,
good treatment or
because
the best treatment.
when you reach a certain age, like when you reach 50,
Mhm.
the doctor said there's certain thing that a lady can have cancer inside. You can the fibroid.
Fibroid.
Sometimes the ladies them under 50 have a lot of fibroid, something like
Yeah.
that.
Oh, you get cut off. Yeah, man. Thanks for joining, Sydney. Tonight we're talking about cervical cancer. Unscripted, anything goes. Straight up. Yeah, man. Straight up. Yeah, man. This show is a nice show. I like it so far. So go and get screened ladies and gentlemen, ladies, go and get your pap smear done. Yeah, go and get the blood work done, because the blood work can actually pick this up as well. Go and get the blood work done. Yeah, what is gonna take out of you more than a couple needles? You know? Yeah, a couple needles is good. Yeah, a couple needles is good. It can save your life. A couple needles can save your life. Yeah, man, couple needles can save your life. Yeah, it's just like my brother here was telling me that he was going to his doctor, and he was going to his doctor, and his doctor was telling him he didn't need certain tests, and then he changed his doctor, and then his doctor sent him for the prostate examination, no, the colon examination, and then he found out that he has polyps on his colon. You see what I mean? And he had to get rid of them, and now he's healthy. So if he would have just listened to that other doctor that he had and didn't go to another doctor so that he get it done, yeah, you never know the results of that. So don't just sit there, stay complacent, and then not get tested. Go and get tested by all means necessary. Even if you have to change doctor to get tested, go and get tested. Yeah, man, couples need couple needles. Yeah, man. Couple needles hard. It's hard, but it's something you can get over. Yeah. It's hard, but you can get over it. You're human beings. We get over worse than that. We get over worse than that. So we can actually you can get over that, ladies. Go and get tested. Yeah, go and get your pap smear done, and then go and get the blood work done, so that you can make sure that you're healthy. Nothing trumps life than health. You have to have health in order to live. Yeah, so you want to make sure that you're healthy so you can have a longevity. Yeah, straight up, unscripted, anything goes. And even if there's something to be found, or something has been found, then the earlier you detect it, is the better it is. Like I heard a brother, died from stomach cancer. Yeah, he died from stomach cancer. I didn't know he was sick. I haven't seen him for about a year. But what I'm hearing from somebody today is that he had it. He had the cancer in his throat, and then he went into remission, but it came back again after a few years as in the stomach, and now he's dead. You see what I mean? So the thing about it is that go and get tested. So who knows? Maybe because he got tested early and detected first, it gave him an extra 5 years on his life. You know what I mean? The extra 5 years to be with his kids, his wife, and all of that. So if you can get an extra 5-10 years in spite of all that, that's a good investment. All you need to do is to go and get tested. Yeah, get tested. Yeah, man, Nicky Diamond, big up yourself. Narco, big up yourself, my brother. Thanks for joining. Unscripted, anything goes. Straight up. So if you are a smoker, if you're a smoker, you actually increase your risk. I get it. It says here, current smoking is a risk for developing cervical cancer due to the ability of carcinogens in cigarette smoke to cause mutation in the DNA. Yeah, in the epidemiological study that have been conducted, smoke was associated with an increased risk of the cells that causes cervical cancer. Straight up. So smoking ladies, if you are ladies that smoke, yeah man, C says, thanks for joining Unscripted, anything goes. So if you're a lady that smokes, yeah, get tested. I'm not telling you to stop smoking, that will be your choice. Yeah, but if I know that it's a risk factor in getting any form of cancer, I would stop. Yeah, I would stop. Yeah, why would I want to increase my risk intentionally? Yeah, I would try to quit smoking. Yeah. But if you are a smoker, yeah, you know that your risk gone up. Go and get tested. Please get tested. Yeah, man. So another factor is the HIV. Yeah, HIV. If you have HIV, your risk goes up to get the human to get the cervical cancer. So it's if the human um, immune deficiency virus. That's what the HIV means. Human what was it now? Human immune deficiency virus. That's HIV. Yeah, a lot of people probably hear the terminology but don't really know exactly what it's saying. So it's the human immune deficiency virus. So it weakens your immunity, weakens until it kills you. It goes to a full-blown HIV and then it kills you. Full-blown AIDS. So it goes from the human indeficiency state to the acquired immune deficiency state where you know by your last breath you're going dead. Yeah, straight up. So this is what it says about the HIV pertaining to cervical cancer. Women infected with the HIV have been shown to have a five-fold risk. Five-fold. So your risk has even increased even more. Five-fold risk of cervical cancer, even higher than the HPV, the human papilloma virus. It says your risk increases five-fold in developing cervical cancer because the HIV weakens the immune system. Yeah. And with that weakened state, it decreases the ability to fight the infection. Therefore, HPV infections are more likely to persist. So if a normal person now is able to fight off the HPV, that is the human papilloma virus, if they're able to fight that off in 2 years without being exposed to another exposure of the HPV, if they're able to do that in 2 years while having HIV, that is the human immune deficiency virus, your chances of getting the cervical cancer or the exposure of the HPV virus, now that window gets wider, it gets bigger, a bigger chance that you wouldn't be able to fight it off as well because your immune system has decreased with the ability to fight the infection. Yeah, your immune system weak. It's weak. So it's not able to fight it off like the normal person who hasn't been exposed to the HIV. This is a thought to provide more time for the HPV to induce cancer. Yeah. So while because your immune system now is weak, while you have the HPV virus, it takes longer to fight it, or your system is not even strong enough to fight it. Hence, the HPV virus now turns to cancer, the cervical cancer. Yeah, straight up. So if you have HIV out there, yeah, you have a higher risk. So don't have HIV and go around swallowing sperm or be promiscuous, swallowing sperm from a lot of men. Don't go around swallowing sperm from a lot of men. Yeah. especially if they're carrying the HPV virus themselves. Yeah, don't go around doing that. Yeah. Yeah, man. Watch your sexual partners. Watch your sexual partners. Yeah, man. Make sure you have people who are monogamous to you. Yeah. And even if they're promiscuous, constantly remind each other to use condoms. Use protection. Yeah, man. So prevention. This is how you possibly can prevent the cervical cancer. Prevention. So, as we described previously, the major risk factor for developing cervical cancer is infection with the HPV. So, what you do? Yeah, don't get HPV. Yeah, don't get HPV. Don't go around, try to be monogamous. If you're going to swallow sperm from one person. Don't be going around every man that you go to and you do oral sex, you swallow their sperms. Don't do that. Don't have every man ejaculate inside of you. You know what I mean? Limit your contraceptive. Don't be going around staying on the pills for a very long period of time. Use condoms instead. Yeah. Yeah, man. Yeah. So, abstinence, it says there. Abstinence is the sure way to preventing infection with virus. So if you're now gonna say, I want to limit my full risk of getting virus. The only way that is sure is not to have sex with nobody. You're abstaining. You abstain from sexual contact. Yeah, and you know that is impossible. Yeah, for sexually active women, as I told you before, use a condom to reduce the risk. Yeah, use a condom to reduce the risk. It will not eliminate it. Yeah, because even though you use the condom for penetration, a lot of you know probably still swallow semen. So don't swallow the semen. Yeah, don't swallow the semen of somebody who you're not monogamous with. Straight up. Don't do that. Yeah. So you have to know what you're doing to reduce your risk. And use the condom. And even if you're gonna like give somebody a blowjob, there's like, what do you call it now? Flavored condoms. You can use those. Use flavored condoms. Yeah. Use flavored condoms. It says 2 vaccines are also available to prevent infections with the form of virus most associated with cervical cancer. So if certain viruses are associated with that can lead to cervical cancer, it says there's might be vaccines for those viruses that can be taken to prevent you getting those viruses, which would lead to cervical cancer. So, so for the human papilloma virus, like for teenagers now, there is a vaccine available for them. I think they take it when they're 12 or 13. So make sure your kids, especially your girls, I think they give it to the girls then. Make sure they take that virus, so that will prevent them from getting the HPV virus. So in the long run, then that is not a risk factor to developing cervical cancer. So at least I get rid of that one there. Straight up. In 2007, a study showed that women demonstrated a link between the use of intrauterine devices, that is the IUD. Yeah, I hope I pronounce that well. Intrauterine. Yeah, intrauterine devices, that is the IUD. So it says that in 2017, the study of 12,000 women demonstrate a link between the IUD device and a reduction rate of cervical cancer. So instead of using the pills, use the IUD or condoms. Women using the device add a 1/3 reduction rate, 33%. If you use the IUD, you have a 33% reduction rate of the risk of getting cervical cancer. So use the IUD, the T, use that instead of the birth control pills. That reduces your risk. See that? We live and we learn. Use the IUD instead of the pills. Or use a condom. The condom is even better. Don't use the pill. Use the IUD. Straight up. The study was not designed to show that IUD use caused a reduction, but the link that was identified, that's the link with the birth control. Researchers suggested that the presence of the IUD in the uterus causes changes in the immune system that helps to fight the HPV virus. So listen to that again, It says that researchers suggest that the presence of the IUD in the uterus causes changes in the immune system that help fight the HPV virus. Man, big up yourself, Andrea Bygrave girl. I love you. Thanks for joining Unscripted. Anything goes. We're talking about cervical cancer tonight. Cervical cancer. So here are some of the symptoms that are associated with HPV virus. Symptoms that are associated with cervical cancer. Early cervical cancer is there's no symptoms. If you're in the early state of cervical cancer, chances are you will not feel any symptoms. But an abnormal vagina bleeding can occur once the cancer becomes invasive. So you might not feel any symptoms at first, but if you can feel something not right with your vagina. And if you feel that, chances are you have something, or it could be possible that you could have cervical cancer. So get screened and get tested. Straight up. Detection. It says since early cervical cancer is there's no symptoms. It's asymptomatic. Regular screening by a pap smear, which we spoke about earlier, by a pap smear is important in order to avoid the progression of the precancerous lesions or non-invasive cancer. Current U.S. guidelines released in 2012 recommend pap smear for women over 21. Screening should then be repeated every 3 years until at least 65. So, constant screening. You get your pap smear done at least every 3 years. Every 3 years, get your pap smear done. If you're 21 years of age and older, get your pap smear done. Man. Get your screening done. To make sure you're clean and healthy. And if you're found to be not clean, then you adjust your lifestyle so you can get rid of that bacteria in there. That infection, the HPV virus, that could possibly lead to the cancer. Man. Delvin is learning about all of these things just the same way you are learning. Yeah, you probably know more than me, but some people out there who don't know, we're going to tell them. Yeah. So get your pap smear done and get your blood work done so that you can actually know what your risks are or if you even have it. Straight up. Yeah, man. Unscripted, anything goes. Yeah, man. If your doctor has concern, then a pap smear can be done yearly. You see that? Yeah. So if you, that's a very valid point, Jacinta. Sorry, that's a very valid point, D-Mac. So if your doctor now has a concern with your health condition or your immune system or your overall health, yeah, and you're found to be in a high risk category, yeah, based upon your family history and all the things that we spoke about earlier, then your doctor might want you to do it every year, and as a result of it, you could be covered by your insurance or your state. Yeah, yeah, man. Good point. So go, ladies, and make sure you get your pap smear done at least every 3 years, according to this. I think over here in Canada, you can get it every 2 years done. Yeah. And if your doctor order you to get it every year, you'll get it. Yeah. Get your pap smear done. Yeah, straight up. So it says here, make sure that you get your pap smear done if you're over the age of 21. Yeah, your screening should be repeated every 3 years. So in the United States, it's probably every 3 years, but over here, I think it's over every 2 years. Go ahead, get your pap smear done. If you have had an history of normal pap smears and a radical hysterectomy, if you had a radical hysterectomy, or it's 3 years over here too. Okay, 3 years over here in Canada, Jacinta says. So if you had a normal pap smear and a radical hysterectomy, yeah, in which the cervix has been removed due to non-cancerous reasons, routine screening via pap smear may not be necessary. So if you're basically, you take out your womb, if you take out your surgery, your womb, yeah, that is hysterectomy, you take out your womb, it says, yeah, or you have your regular pap smear done. Yeah. A routine screening via the pap smear may not even be necessary. The American Cancer Society recommends screening with pap smear and HPV DNA testing every 5 years. So for you now, if you have an hysterectomy done, you don't need even to do it according to this every 3 years. Every 5 years is good for you between 30 and age 65. Yeah, pap smear every 3 years is basically for the women them who still have their wombs and straight up. So if you have an hysterectomy done every 5 years, if you don't have one of those, every 3 years. Yeah, man. Straight up, unscripted, anything goes. Woman with prenatal exposure, yeah, have a history of a woman with prenatal exposure, a prior history of cervical cancer, or disease condition that weakens their immune system should continue screening past 65. So listen to what it says here now. If you're a woman that has prenatal exposure or past history of cervical cancer, yeah, or a disease condition that weakens your immune system. So once your doctor diagnosed that your immune system is low and weak for some purpose or reason, yeah, it doesn't matter. The 65 rule don't apply to you anymore. Even past 65, you should be screening for cervical cancer. Even past 65, you should be screening for cervical cancer. Straight up, unscripted, anything goes. Yeah, man. All right, Dana. Yeah, all right. I'll look at it after. All right, no problem. Yeah. I'll look at it after. Yeah, man. Straight up, unscripted, anything goes. Yeah, man, this thing is nice because we're learning. We're learning about the cervical thing. I want dangerous something. Dangerous something. Big up yourself, Sharon Tucker. I love you, girl. I love you. Thanks for joining. Unscripted, anything goes. Although cancer of the ovaries, cervix, and uterus may be difficult to detect at early stages, there are several detection options. Sorry about that. Sorry. There are several detection options that are available. Yeah. So before 22 years old, you don't have to do it because chances are, you won't get it. But even though the cancer is hard to detect at an early age or stage, there are several detection options that are available according to this. There is some evidence that testing for HPV may be a better way to prevent development of cancer than the pap smear. But these results needs to be confirmed before any recommendations and changes. Important tests for detecting cancers of female reproductive tracts includes the pap smear for detecting cervical cancer and vaginal cancer, ultrasounds to detect ovarian or uterine cancer, that is the cancer of the uterus, detecting, so it says the CA125 for detecting ovarian cancer, and we're going to talk about ovarian cancer tomorrow. Yeah, if the diagnostic test indicates the presence of cancer, additional imaging may be performed to determine the location and the extent to which you have been exposed to the disease. Yeah. So what he's saying is that there's a series of tests that can be done depending on how old you are and the stage that you are and how far gone you are in the cancer process. So consult with your doctor. Yeah, if they now tell you that you have the HPV virus or you are now in the early stage of cervical cancer, consult with your doctor. Straight up. Yeah, man. Because this sequence can be disrupted when the virus. Okay, let's go back a little bit. Yeah, it says specific tests for the HPV virus may be administered automatically to women over 30, which lessens the necessity of the pap smear to once every 5 years. So if you are now getting tests by your doctor for the HPV virus annually during your physical, if the doctor is testing you for that and you're good, yeah, you don't have to get tests for the cervical cancer every 3 years. You can get tests for that every 5 years instead. So the pap smear you don't have to do every 3 years. You can actually do the pap smear every 5 years. If you get tested for the HPV virus every year by your doctor throughout your physical. Yeah, very important. Very important. Yeah. It says in a recent study, the addition of HPV DNA tests to traditional pap smear reduces the incidence of grade 2-3 cervical interparietal neosposia by 40%. I don't know what that is. So you have to look that up if you want. Yeah. So if you do this test, it says the traditional HPV DNA test, to the and also the traditional pap smear tests. Yeah. You can actually reduce what it says now. You can actually reduce the cervical cancer risk by 40%. That's what it says here. Treatment. Let's get into that part. Treatment for HPV virus. treatment. All right? Treatment. It says, depending on the stage and location of the cancer, several different treatment options are used for cervical cancer. 1, surgery. All right? Surgery. It's cryosurgery or cryosurgery. And that is used as a pre-invasive cancer. It kills the cancer cells by freezing them with more metal probe that has been cooled by liquid nitrogen. So whatever that is, the surgical procedure. So basically they kill the cancer cells by freezing them. I think I see that procedure done already. It's like a freezing kind of thing that they use now to freeze the cancer cells and with liquid nitrogen and burn them out, really. Yeah, so that's what they use for that. The second one is what they call it now, laser surgery. They use laser use for pre-invasive surgery. The laser beam are used to burn off abnormal cells and remove tissues for the study. So they use the laser beam and burn off the abnormal cells that you have and study them to see whether or not what stage of development of the cancer that you're in and how they can treat it. Straight up. It says a bone biopsy. They also use a bone biopsy. A bone biopsy is used. It's used to preserve fertility in women with early stage of cancer. So they use the bone biopsy to preserve the fertility in women at an early stage of the cancer, or to obtain sample to further study. A cone-shaped section of a tissue is used or is taken from the cervix. So they take a cone-shaped portion of the tissue, and they use that now to study the cancer, to see what stage you are, especially in the early stage. If they know that you're in the early stage, they use that now to study it to see how they can best treat you, so that they can actually preserve you now, still having the ability to have kids going forward. A simple hysterectomy. Alright? So the uterus or the cervix is removed either through the vagina or the abdomen walls. And this will result in infertility. So once they take out your womb, you can't have kids anymore. You're not fertile anymore. You don't have a womb. Yeah. Basically. Yeah. So if you're at the stage where now it's decided by your doctors and your surgeon that, yeah, either your womb or you're going dead, I would say take the womb out. So what they would do now is do the hysterectomy and take your womb out. You take your womb out and then you won't be able to have kids anymore. But at least you would still have life. Yeah, man. You'd still have life. Yeah, man. Yeah, straight up. That's a simple hysterectomy. Alright? A radical hysterectomy now. And a pelvic lymph node dissection. So not only are they gonna take out the womb, they're gonna now take out the lymph nodes. Yeah. So now they're gonna take out the uterus, the upper vagina, and the lymph nodes are removed through the vagina and abdomen wall. And once they do all of that now, you can't have kids. You're infertile again. Yeah, that is deep. I'm taking out everything. Yeah, they're taking out everything. a pelvic externation. Yeah. For recurring cancers. So if you've had the cancer before and you actually went in remission but it actually came back, it says here that for a recurrent cancer, a radical hysterectomy is accompanied by removal of your bladder. Now they're going to remove your bladder. A removal of your bladder, the vagina itself, they're going to remove that as well. Yeah, the rectum and part of the colon, result in infertility. For detail on the cervical, yeah. So you're gonna have to review check that out if you want to know more about it. So a radical pelvic externation, where they're gonna now remove everything: your vagina, your rectum, and part of your colon. Boy, what you gonna have next? What you gonna have leave? Just a hole. You're just gonna have a hole there. What use is just the holes? You know what I mean? Yeah. Another solution for dealing with this is radiation, chemotherapy. Yeah. So if it's not at the stage where it's so far gone to do all of that procedure, then radiation is an alternative. So either external radiation or internal radiation can be used to burn the cancer cells out. Yeah. Yeah. So check out the radiation on that. So the radiation and chemotherapy. Several different drugs may be also used to treat primary or recurrent cervical cancer. So chemotherapy is also a part of that. So you can also check out that as well if you need to go that direction. So if you're a woman and you're diagnosed with cervical cancer, I would suggest that you sit with your medical practitioner and the surgeons and decide what's best for you, So that is the lecture tonight on cervical cancer. And the last thing I want to leave you guys with is to make sure that you guys get tested, because testing is what is important. And get your pap smear done. And once you get your pap smear done, then hopefully you're okay. And if you're not okay, then talk to your doctor and see what's best for you. Yeah, man. Any questions before I wrap up the show? Yeah, man, I thought it was a good show tonight because I've learned a lot more about this thing. So remember to always, in everything, consult with your doctor, because your doctor knows what's best for your health and medical condition. Straight up. And you can go ahead and go online and read about cervical cancer. So tomorrow we're going to talk about ovarian cancer. Good night, Sonia. Thanks for joining Unscripted Anything Goes. Yeah, man. So we're back here tomorrow talking about ovarian cancer. So until tomorrow, yeah, I want to tell you, I love you. I love you. Remember to embrace conservative values, because we don't have badges nor guns. We must support the police. Bye-bye. Bye-bye.